It actually depends on the epidemiology of where you live, but usually the three more important ones are Lyme's disease, HTLV1, and syphilis. Those are the most important mimickers we should always look for. Well, usually when we think about diseases, it's kind of easy because we think about fever, malaise, we think about a lot of fatigue, people that really don't feel well, and it's kind of obvious that they have an infectious disease. But the problem is when we have a chronic disease that's acting in a very, very smoldering way. So the first and most important thing to try to figure out what the right diagnosis is if we are facing a patient that we suspect that maybe he has MS because we have an MRI that has lesions that probably look like, is a very good clinical history, asking about infectious diseases, vaccines, troubles, any contacts that may suggest HIV or syphilis, and also very, very, very good physical exam. We need to search in the skin for any rash, any different manifestations, scars. For example, we can see there is a characteristic rash for Lyme's disease that's called erythema migrans. So we need to ask if they have seen anything weird or anything like redness in their skin, and that has been moving around. Also, we need to see if there are other infectious signs in the physical exams, abscesses, pain, abdominal pain, any adenopathies, for example. And then after that, we need to go to the labs, the general labs, to rule out any infections. Usually with the blood work like CBC or some markers for inflammation are very good screening markers to say this is something that maybe can be something infectious and not an MS disease, because MS, every parameter should be normal. CBC should be normal, no inflammation, systemic inflammation. Patients are actually talking like you and me, but they are having other symptoms that are pure neurologically, except for the fatigue. But usually when we see somebody that is infected, we can suspect it's only an infection and not a multiple sclerosis or a neurodegenerative disease. I think there are a lot of mimickers. There are tons. So it's hard if you want to memorize each one of them, but I think the easiest way of making a good approach is trying to classify the different diseases that can affect different parts of the central nervous system. With the exception of syphilis, that we can have lesions anywhere. They're very similar. They can be supratentorial, infratentorial, in the spinal cord. But the key for the describing a lesion of MS is that we have the open ring. The lesions are very delimited. They're round, periventricular, perivenular, and these other lesions in the within the infectious spectrum are not well shaped. The borders of the lesions are very diffuse. The enhancement of the gadolinium, that's the contrast of the MRI, is not quite a ring. It can be fulfilling all the lesion, etc. So going back to what I said about trying to classify the different lesions, we should always keep in mind, like we see in the MRI, these lesions that look kind of MS, but have these different characteristics. So if they are for example, they are supratentorial, we should look for borreliosis if the local epidemiology suggests that. If we are looking infratentorial, viruses love the the infradilatorial region, especially the pons and mesencephalon. So we should look for herpes simplex, herpes zoster, among others. Adenovirus, parvoviruses, flavivirus, a lot of viruses. Usually this happens more in pediatric population, but if we see something in the infradilatorial region, we should look for viruses especially. And then the spinal cord is the most popular region for HIV, syphilis, because we have this very, very common syndrome that's called tabes dorsalis, that patients have ataxia, and that's very progressive. And other viruses like cytomegalovirus or different herpes too, but the most important ones here are the syphilis and HIV.